As the temps start rising, I feel the familiar urge to refresh my closet, but I don't want to waste money on pieces I'll only wear once or for just one season. Thankfully, Quince changes that. Their clothes are timeless, lightweight, and far more elevated than anything else at this price. It finally feels like my wardrobe matches my standards. The best part is that Quince only works with factories that use safe, ethical, and responsible manufacturing practices and premium fabrics and finishes, so you get to look good while feeling good. I'm pretty excited that I have upgraded my athleisure wardrobe for this summer. I bought a sweatshirt and a pair of wide-leg flow pants that are two of the softest items I own, and I plan to live in them. So join me in giving your summer closet an upgrade with Quince. Go to quince.com/POTC for free shipping on your order and 365-day returns. That's QUINCE.com/POTC to get free shipping and 365-day returns. Quince.com/POTC.
So I like to build up the patient's confidence that, look, we're not going to change things overnight. But also when you're feeling symptoms of anxiety or symptoms of your IBS or GI condition, if we can activate, if we go back to brain gut, if we can activate something called your parasympathetic system, your body's relaxation response, I promise you that's going to make it easier to manage the situation.
That was Dr. Megan Riehl on Psychologists Off the Clock.
We are four experts in psychology here to bring you cutting-edge and science-based ideas to help you flourish in your relationships, work, and health.
I'm Dr. Debbie Sorensen, a clinical psychologist practicing in Mile High, Denver, Colorado, and author of Act for Burnout, Act Daily Journal, and the Act Daily Card Deck.
From America's Heartland, I'm Dr. Emily Edlin, a clinical psychologist based in Chicago, Illinois, and author of Autonomy Supportive Parenting.
Calling in from Vienna, Austria, I'm Michael Herold, ACT coach, confidence trainer, and author of an upcoming book on being a better conversationalist and making friends.
And from coastal New England, I'm Dr. Jill Stoddard, author of Be Mighty, The Big Book of ACT Metaphors, and Imposter No More.
We hope you take what you learn here to build a rich and meaningful life.
Thank you for listening to Psychologists Off the Clock.
Hi, everyone. It's Emily, and I'm here with Debbie today to introduce an episode that's near and dear to my heart because I've worked for years as a health psychologist trained specifically in therapies for the gut. Those of us with this training are called GI psychologists, and my GI psychologist colleague, Megan Riehl, co-wrote an amazing new book that brings what we do in our offices to the everyday reader, which is what we're going to be talking about today. So, Debbie, you practically begged to do this co-host intro with me.
I know.
So,
I did. Isn't that funny?
What did you think?
Sign me up.
Yeah.
Well, first of all, I think it's really fascinating, right? The brain-gut connection and the microbiome and some of these conditions that people have that have kind of both this physical and also, emotional and psychological component. And hold on. And it was really refreshing to me to hear this conversation between the two of you who are both trained, evidence-based practitioners in this area, because I think there's so much pseudoscience out there and people trying to make claims and giving people these, people are so desperate for help that they sometimes will latch on to anything. And you have to beware. I think it's something we've talked about on the podcast a lot of times before. And so to hear you two experts talk about it was great. And Emily, we've realized before, I think part of the reason I begged to do this episode with you is that we both have a health psychology background. I did work in this area in chronic pain and chronic health conditions with adults earlier in my career. And you are currently doing a lot of work in this space, specifically with children. And I think our listeners may not know about this. So could you tell us a little bit about what you're up to in this area?
Yeah. This is actually my day job. All this other stuff is the side hustle. No.
Yeah, you got to have a side hustle nowadays, it seems like, right?
More of my passion on the side.
Yeah.
But
yeah.
No, I was trained from graduate school through all my internship and fellowship in pediatric health psychology. And so working in children's hospitals, I spent years working with seriously ill children in the hospitals during treatment. And then I also worked in outpatient clinics for different medical problems, such as chronic pain. And then when my career kind of took a fork in the road, and I decided it wasn't lining up for me anymore to work inpatient, because that is very demanding, I found a private practice that specializes in outpatient health psychology services, which is hard to find. Usually health psychology is embedded in medical settings, whether it's hospitals or medical clinics. But this is a freestanding outpatient therapy office that serves people with medical conditions of all types, but we specialize with gastrointestinal or GI conditions.
Well, we can link to that in our show notes so that if anyone wants to learn more and check out your clinic, they can find it easily.
Yeah, and I'll just say we actually have some great new therapists and some openings right now, and we can work in most states in the country because of PsyPact, which allows psychologists with licenses to work in other states with that same approval. So if people are interested, please look at our practice and we will do our best to get you in with someone.
Well, and I think it's really cool because people often think of these kind of conditions as a medical condition without recognizing the important role of mental health and psychology. And I mean, the evidence is solid that this is sometimes the most helpful intervention of all, but sometimes it's hard to find it. Or, you go to the doctor for a condition and they don't, even the providers themselves don't think to incorporate a psychologist into the work. And so if you're having trouble finding that interdisciplinary clinic approach, there are specialists out there who can help. And then self-help resources like this podcast episode and like her book, which sounds terrific. I don't have a GI condition, but I'm honestly thinking about checking it out just out of curiosity because I think it's really, really interesting stuff.
Well, it's very useful. And I would say, even without a diagnosis, not everyone has irritable bowel syndrome, which is what this book is specifically designed for. But I would say most Americans, especially with the kind of diet we have, probably have some GI symptoms, with
happens to the best of us. We don't need to go into detail.
Yeah. But it can cause suffering, and getting in the way of life, whether it's because you don't want to go out or you just don't feel well. So anyways, I think that hopefully this conversation is actually pretty relevant to most listeners with or without a GI diagnosis. But I think to come back to your point about health psychology is the interplay between biology and psychology. And the more research and science that's been done, the clearer it is that mental health is health. Like, it's not a separate process. It's all tied up together. Physical health and mental health is health. So I think that it's great to have this interview as an example of how the brain is really connected to the gut, how that affects our mood and stress and our whole experience. So I really hope listeners learn a lot from this episode and get as excited about the power of the gut-brain connection as we did. Dr. Megan Riehl is a clinical health psychologist, an associate professor of medicine, and director of GI behavioral health at the University of Michigan. Her research and passion for education have resulted in numerous peer-reviewed publications, leadership roles, and lectures. This year, together with digestive health expert Kate Scarlata, they co-authored Mind Your Gut, the science-based whole-body guide to living well with IBS, and launched the Gut Health podcast. I am so excited today to have Megan on. Welcome.
Thank you. It's my pleasure to be here.
So I have kind of become the parenting point person for this podcast. And that's what I spend a lot of my time doing, is writing about parenting.
I love reading about you,
thank you.
Writing about parenting. Thank you for doing that.
Well, Megan, you and I have kind of crossed paths over the years with your work, and I've seen you at conferences, and I'm just so impressed with all you have accomplished. So I'm glad to have you on Psychologist Off the Clock today.
Thank you.
So I want to set the stage by saying that although this book was written and designed for people with IBS or irritable bowel syndrome, I really want us to focus today on understanding our gut in general. Even those of us without an IBS diagnosis, especially if we're eating an American diet, probably have regular GI symptoms like bloating. And one reason for this that we will spend time talking about today is the effects of stress on the gut. So I think this conversation can be really interesting, whether or not someone has an actual diagnosis, because we have learned so much about the gut over the past couple decades, probably. So let's start with defining what we're talking about when we say GI or gastrointestinal system. What does that encompass?
Well, it really encompasses a lot more than people think. So they might think GI and think about their stomach, which is clearly a GI organ, but really mouth to anus, and then also brain. And so I think that stepping back and recognizing that when we think about our gastrointestinal tract, it starts with the food that we put in, and then it goes down the esophagus, through the digestive system, all the way out to hopefully having a lovely, easy to pass bowel movement, right? Like that's part of the gastrointestinal tract. But we all have a brain and we all have a gut, and they are constantly communicating for people, thinking about things that you're aware of, like I'm hungry, or not being aware of the actual digestive process that's taking place. And so when we think about GI, gastrointestinal conditions, it can really be a wide spectrum of conditions that can include both diseases like inflammatory bowel disease, which is organic in nature. There can be ulceration and actual disease in your mucosa that makes up, again, that very wide-ranging mouth to anus kind of location. And then there can be disorders or conditions like irritable bowel syndrome that when you go and you get a medical workup, it might look like, hey, everything is normal or within normal limits or benign. Those are the words that your doctors might use. But unfortunately, you can really be suffering with a variety of different symptoms that we'll probably dive into as we talk.
Yes. And, I want people to realize even burping and heartburn, acid reflux, that is part of the GI system. There's the upper GI and then the lower GI.
That's exactly right.
And I think people often are just thinking of the lower when they think of GI, right?
And in fact, the bulk of my very, very early career at Northwestern University with esophageal specialists was working almost exclusively with patients that had heartburn, belching, an interesting diagnosis called globus, where there's the sensation that there's something stuck in your throat that, there's nothing actually there. So you make a really good point that, it's wide ranging, and there are upper GI conditions and lower GI conditions.
It's so interesting. I had globus when I was probably 16. I was a very stressed out 16-year-old. And so I know the sensation, but it was never diagnosed. I only can retroactively now see that was what was going on. It was such a strong sensation of the stuckness in my throat. So, but
your doctors probably wouldn't have known what to do with it. So, they might have stuck you on a proton pump inhibitor like omeprazole, or told you, just live with it. And so for anybody that's suffering with that diagnosis, our brain gut behavioral therapies are actually quite effective for that condition.
Yes. And we will talk a lot about those therapies. That's so exciting how effective they are. You mentioned how our brain is involved. And in fact, we now call the gut the second brain. And I think this is so fascinating. The science of this is really interesting. So could you explain how the gut is the second brain including kind of the enteric nervous system and what that even is. So we do talk about the nervous system in terms of polyvagal theory and what's happening with stress and anxiety, but I'd like to pull in the gut to this explanation.
Yeah. You want to think about that connection between your brain and your gut as a bidirectional superhighway. And what drives that is that enteric nervous system that basically lines from your brain to your gut along your central nervous system. And so knowing that there are actual brain functions that impact the functioning of your digestive tract, and also that your digestive tract is sending signals up to your brain, and it's happening along this pathway. I think that that is really empowering for people to recognize, especially people that are suffering with gastrointestinal issues, because there have been times where they get that normal workup and they unfortunately have been made to feel like, just don't stress, or that nothing's wrong, or this is in your head, God forbid.
Yes.
That's the one that just is a killer for people, to be stigmatized and invalidated, that this is just in your head, when these symptoms can have such a profound impact on one's quality of life. So when we start to learn about the way the brain and the gut are so interconnected, and that actually mood and stress and food and, a variety of, we call it multifactorial impact on the functioning of your gastrointestinal tract. All of those factors can create different neurotransmitters and chemicals that affect the microbiota, and also the way in which your digestive process happens, how you experience pain in the gastrointestinal tract. And so when we know that the brain produces chemicals, but also the gut too, then we have a better roadmap for treatment. And so that's where we enter in. A lot of people's experience has been they go to their medical doctor, they try medications, and when and if a medication doesn't work, that's usually been the point where maybe you try diet. And now more and more, we recognize that our psychological therapies that have been tailored and targeted and tested in science are actually really effective at addressing the way the brain and the gut communicate. So we call those therapies brain-gut behavioral therapies. And we can help to restore the way the brain and the gut are communicating, which can then impact a variety of features of your gastrointestinal tract and your functioning.
I think it's such a validating explanation for people who are suffering these symptoms, who aren't going to have findings on an ultrasound or in their blood work that say, this is what's wrong with you. I mean, it's probably a majority of people with GI symptoms who don't have that clear diagnostic criteria, right?
Yeah.
And so when they come to us, it's as therapists, it's often with some trepidation of, well, my doctor says there's nothing wrong and sent me to therapy, which they come in thinking, even if the doctor didn't say it, the message may feel like it's all in my head, right? Mm-hmm. Which feels terrible when you're suffering these physical symptoms. And so I like to say, well, it is all in your head in the sense of how your brain is communicating with your gut. And that's what we're here to work on. So I think that just helps kind of reduce that stigma too.
Yeah.
So let's get into the details of how stress, anxiety, and the GI system interact. So can you explain a little more how stress and anxiety are so implicated in GI symptoms?
Yeah. So I want listeners to really think about this again as bidirectional. So, in my clinical practice, people are coming to me to help with their GI condition. And a lot of times they have a history of this GI problem that has led them to have anxiety and stress. And that might look like, now I don't go out to dinner anymore because I don't know where a bathroom's going to be. I don't know if it's going to be a single stall. I don't want to get stuck in the bathroom. That would be embarrassing. I don't know what foods to eat, so I just don't go anymore. And in our work, we see a lot of avoidant behaviors because of the either fear of having symptoms or because of the symptoms. So we see that this anxiety is really driven by the GI condition. And it's like a snowball effect where things can just get worse and worse and worse and worse. And so we have to untangle that. Then we also know that people with, and maybe I'll start by calling this group of gastrointestinal conditions that IBS falls under. We call them disorders of gut-brain interaction, or DGBI. And that can include a lot of what used to be called commonly functional bowel disorders, which again, it includes IBS, it includes things like functional dyspepsia, the functional diarrheas, the functional constipations. And so in this DGBI space of people that are living with these conditions, that group of people have higher prevalence rates of anxiety, depression compared to the general population.
Well, let's quickly define functional. So the words functional dyspepsia, functional constipation, what is that referring to?
Great question. It means, again, you're going to go through typically an endoscopy, a colonoscopy. Your doctors are going to look to rule out any other organic condition, again, commonly an inflammatory bowel disease. They're going to rule out any cancers. And this is the difficulty, right? We hear functional, and so many people that are living with IBS are like, I am not functional. This is not a functional condition.
Not functioning.
And therefore, that's why we made this switch to a more accurate description of this is a disorder between your brain and your gut. There's dysregulation happening between this interaction. And so, functional just unfortunately means that there's no organic disease to better explain your symptoms. And therefore, we're going to have to use a variety of different treatments to get you feeling better.
Thank you.
It's a really important point to make. And really, even there are lots of medical providers that are still using the terminology functional bowel disorder. So lots of your listeners are probably going to have either Googled and found, under the umbrella of functional bowel disorder is this, IBS. But the field is really trying to move over into a more validating, a less stigmatizing category of this disorders of gut-brain interaction.
And it's more precise, really. Disorder of gut-brain interaction. There's a problem with how the gut and brain are interacting and communicating.
Right. And also that communication problem is driven by a very complex intersection of life. It could be, and going all the way back to early childhood experiences, things that happen in utero, things that happen environmentally, things that happen, from a nutrition standpoint. So that's also, I think, what can, when we're thinking about mood and the variety of factors of how, somebody that's anxious is more prone to IBS as opposed to somebody that's not anxious. Or as I kind of started off the question with, recognizing that you might not have had anxiety or depression ever until you got IBS or another GI condition. And now you're trying to untangle all of that and manage that.
Right. I mean, this is the complexity of all of this, is there's so many different pathways to very similar symptoms. So two people have very similar symptoms, but their bodies developed these symptoms from very distinct pathways. Do you want to just touch on the relationship with trauma?
Yeah. So there is a high prevalence of trauma, again, in really, if we look just taking a step back at GI conditions in general. In fact, one of our colleagues, Dr. Tiffany Taft, has done some really profound, innovative research looking at trauma in patients that have inflammatory bowel disease. And the numbers are very staggering in terms of between a quarter and a third of patients with IBD have post-traumatic stress symptoms associated specifically with their inflammatory bowel experience.
Right. And I want to just clarify that IBD includes most commonly known Crohn's and ulcerative colitis, if people aren't really sure. I think most people have heard of Crohn's and
yes,
ulcerative colitis. Okay.
Yes. And I think really just highlighting that IBS, irritable bowel syndrome, and IBD are very different. Yeah. Sometimes the symptoms present very similarly: abdominal pain, diarrhea, fatigue, lots of different symptoms that can fall in these categories. But IBS is that disorder of gut-brain interaction, whereas inflammatory bowel disease is going to be diagnosed by looking at colonoscopy, endoscopy, ultrasounds, blood work, stool samples, and that can give us a more definitive diagnosis also with inflammatory bowel disease. So we know that there's trauma for patients that have IBD, but we also know that trauma, whether it happens in early childhood or it could be an acute traumatic situation, that impacts our body. It impacts our nervous system. It impacts our immune system. And therefore, we find in research that these experiences can make you more prone to things like GI conditions, as well as other, chronic pain syndromes and diagnoses that, unfortunately, you've got enough to deal with the psychological aspects of a trauma. And unfortunately, that trauma can also impact you physically.
Right. And as we were talking about, there's childhood trauma or acute other types of trauma. And then there's medical trauma, right? Like traumas associated with medical evaluation and treatment.
And when we think about gastrointestinal issues, it's not uncommon for your doctor to put hands on you. They should, in fact. You should at some point, if you have abdominal pain, have a doctor that's going to palpate your stomach. But also there could be a rectal exam, even putting a gown on in a room. My colleague, Dr. Christina Jagelski at the University of Michigan, is really starting to dive into trauma work as well and assessing gastroenterologists' comfortability with talking about trauma with their GI patients. And there's not a lot of research in this area, whereas it's so important that the relationship as a patient and a gastroenterologist, number one, it's typically a pretty long-term relationship, right? Because whether it's IBS or IBD or anything in the middle, or along that spectrum, these are chronic. They are often what we call relapsing and remitting. And so you typically are going to find a gastroenterologist, and it might take some time to find one that you really like and feel listened to, and you have a good relationship, shared decision-making happens. And you're going to work with that provider probably for, maybe as long as they're providing. And so you oftentimes will get better care if you find a way to disclose your psychological history, whether it be a trauma history, whether it be that you have anxiety or depression or post-traumatic stress. That way they can work with you to create the most comfortable environment when you are having a colonoscopy or when you do have to have a physical exam. So,
these symptoms themselves are hard to talk about. These are not cocktail party conversations. And then you add in an actual physical evaluation where it can feel very invasive. So this is it's just a very delicate situation. And I think it's important to acknowledge how critical those relationships with the medical team members is in your experience of treatment and getting better and your likelihood to actually improve with your symptoms. So speaking of, I want to make sure we talk about the dream team.
Yeah.
So what is the dream team?
Yeah, as you were talking, I'm thinking about I want everybody to know that if you don't have providers that listen to you and that you're not getting better, that you really are looking for a dream team, that you want a gastroenterologist or a primary care physician who has confidently provided you with your diagnosis. Because that's a good, that's a pretty important starting point, right? You need to know what your diagnosis is. You need to understand your diagnosis and why. And usually the gastroenterologist, I'll just use that as kind of the starting point, they're going to be happy to involve the rest of the team, which can include a GI dietitian. So this is a dietitian who specializes in using nutrition therapy in the management of GI conditions. And with a registered dietitian, that's the first kind of thing that you're looking for. Then somebody that specializes in gastrointestinal conditions. So the ideal GI dietitian is going to be a part of your treatment team, and they will create the nutrition plan for you. They'll talk about what your options are, which might not necessarily be a fully restrictive diet like the low FODMAP diet. Not everybody with IBS needs to be on the low FODMAP diet. The other person that we say as a part of the dream team is a GI psychologist like myself. So again, I have a doctorate in clinical psychology, and then I had further training in health, and then I had further training in gastroenterology. And my expertise is in applying our psychological therapies to the management of the GI condition. Then we have other members of the dream team that could include a general mental health provider. A pelvic floor physical therapist can be a huge kind of benefit to the team. A social worker, a psychiatrist, a good primary care doctor. So, at the heart, you've got your gastroenterologist, your GI psychologist, your nutritionist, or your GI dietitian. And then we really look at who else needs to be on the team or who else is a really important member. That's the goal.
It is a worthy goal. And I think the more that people have this information, the better they can advocate and just know that this is even a possibility to have all of these people involved. So I think it's really important to arm people with this information and why it matters, which is better outcomes.
Well, and the reason we wrote the book was because, unfortunately, a lot of people don't necessarily have direct access to this dream team. And so to your point, exactly, we wanted the general population to recognize, number one, this is available. Some of these options are out there. You've probably never heard of them because even at present, a lot of this kind of dream team approach is available at academic institutions or at very niche private practices. And so, when patients do have access to that and they get so much better, it is heartbreaking on our hearts as clinicians to recognize, at least 45 million Americans have IBS. And we want as many people out there to have at least, a book that they can trust, has science-based information and a tool kind of kit for you. And then we provide resources as to, if this was helpful, here's how you might go find somebody that you could work with in person if you need that additional support.
And I will attest, reading the book, that there are so many strategies and exercises that people can do on their own with the book, having that as the guidance. It's the exact same thing we do in the therapy office. So it really does replicate what we would do if you were able to see a therapist with this specialty. So let's talk about these therapies, the psychological therapies. It's mostly rooted in cognitive behavioral therapy, right? A lot of this is taking what we know from CBT and applying it to GI symptoms. And it's all been very well tested and validated that these are effective treatments. Let's just touch on, I think, two of the biggest, most powerful interventions are cognitive reframing and decreasing behavioral avoidance. So could you just give maybe typical examples of how those two are really important in treating GI?
Yeah. So cognitive reframing is where we help patients to first observe how they're thinking in certain situations. And then we work together to identify those common cognitions, like I'm a catastrophizer, or I'm thinking about things in an all or nothing fashion. So I either am able to go to my son's piano recital or I can't go. There's no in between. I couldn't possibly handle, either if I'm symptomatic going or, not. So we help people start to identify their thinking patterns. And then as they observe it, they're able to kind of, one of the best kind of very easy ways to think about is your thinking helping or hurting the situation? And then we think of alternative ways of thinking about the situation. So an example might be, I woke up this morning and my stomach was gurgling, cramping, spasming. I have to go to the bathroom. My day is ruined. And so we might help a patient take a step back out and say, my stomach is gurgling, cramping, spasming. I've gone to the bathroom. What are some of the strategies in the moment that I can start to address? I'm going to practice some diaphragmatic breathing. I'm going to let myself go to the bathroom. And I'm going to take steps throughout the day to take things one at a time. I don't have to worry about what's happening tonight because right now it's 7:30 in the morning. And as you, as a therapist and as a patient, start to kind of talk through the difference between how they feel thinking about it as my day is ruined versus actually it's just 7:30 in the morning. Let's take this as it comes and let me use my skills and my strategies. It starts to allow people to experience their symptoms different, to manage their symptoms differently. And that also reduces a lot of the anxiety associated with the symptoms. So essentially, we're managing the anxiety.
Right. And that's what a lot of these interventions really are, is
Totally.
managing the anxiety that then benefits the GI symptom experience through that anxiety management.
Yes.
And these cognitive strategies then affect behavior.
Exactly. So sometimes the way I like to identify or talk to patients about this is, the way you've been thinking is likely the way you've been thinking for either your whole life or something happened and it changed the way you think about or you manage. And so when I'm talking about cognitive behavioral therapy and that we're going to use reframing, that can at times feel very overwhelming for patients. It can feel very challenging to be like, okay, even I can identify the unhelpful thought, but I don't even know what to do with that yet. So I'll talk about, okay, good. Well, we can do the behavioral side of things too. That if you change your behavior, that's going to help you change how you think about things, or it might give your body a chance to kind of calm down, and then you can think about the situation differently. So I like to build up the patient's confidence that, look, we're not going to change things overnight. But also when you're feeling symptoms of anxiety or symptoms of your IBS or GI condition, if we go back to brain gut, if we can activate something called your parasympathetic system, your body's relaxation response, I promise you that's going to make it easier to manage the situation. So I'll teach some of those, we call them modifications of arousal, where we empower the patient with a variety of relaxation strategies that they can implement in the minute. And I love the aha moments that happen pretty quickly in therapy as they buy in and start to practice these things.
Yes, it is really powerful to watch how quickly things do change when people start using these strategies. It's very gratifying as a therapist.
Yeah.
When therapy can actually take a long time to see any difference, but in this situation, it can actually happen quite quickly to just kind of reset some of these automatic habits that have developed, both the thinking and behavior habits that have developed over time, to just sort of interrupt that can be really powerful. So speaking of relaxation, I really want to talk about hypnosis. This is such an incredible, I think, secret almost. I think a lot of people would not think of hypnosis as a scientific treatment, like scientifically supported treatment for a GI condition.
Yeah.
Right? So first, let's differentiate as we do. So both of us are trained in hypnotherapy. Let's differentiate stage hypnosis versus clinical hypnosis.
Because I think that's where most people are thinking back to a cruise ship that they were on and somebody was doing hypnosis, or their senior party and somebody was doing hypnosis. And that's fun and entertainment. And usually the crowd is like invested in it. So the stage person is looking for the people that are going to perform for them. That's where I like to help kind of show people that even if you don't think you are hypnotizable, if you're open to trying it for your GI condition, that's all I'm looking for. So then I start to talk about the science. So hypnotherapy, and we call it a couple different things. So you might have a provider introduce it as gut-directed hypnotherapy, gut-directed relaxation, medical hypnosis. All of these different terms basically are talking about this psychological intervention that gets at the functioning of your brain and your gut, utilizing, in a lot of ways, scripted protocols that have been developed. So there are a couple scripted protocols that most of us are using in clinical practice that range between 7 sessions and 12 sessions and are, as you mentioned, scientifically validated. There's evidence that supports the improvement of the digestive symptoms and also psychological improvement with use of therapy.
And that improvement is over the long term, not just right after the intervention.
That's right. So we call that durability. And the durability and efficacy of gut-directed hypnotherapy is up to 5 years. And that means that you can complete treatment. And we have patients that never do another hypnosis session for the rest of their, time, and they maintain their gains. And the gains, I think, I love giving talks on this because the improvements that patients have with gut-directed hypnosis are better than any other medical treatment available for specifically IBS. That's where the bulk of, there's over 40 years of science looking at the use of hypnosis for IBS. And even patients that have not gotten results with medical treatment, traditional medical treatment, can still get results from hypnosis. So if you can find a provider that utilizes this therapy, it is grounded in science and it is effective. And unfortunately, again, a lot of people haven't heard about it because there are still limited numbers in terms of providers who use this type of intervention. But the numbers are growing. And then there's also the emergence of digital therapeutics that I think, like our book, we're trying to improve access to these types of strategies. And we do give a couple scripts in the book. But there are also other innovations that are increasing access to these types of therapies that are effective.
So when you say digital therapeutics, do you mean apps?
Totally. Yep.
Yes. Okay.
You can go to the App Store and download Nerva, which is a gut-directed hypnotherapy app. And you could start that intervention today. And that we didn't have a few years ago. And there are other apps out there, but Nerva, I find, is continuing to do more research. They just presented at DDW, which is our large GI conference, and really comparable outcomes to whether you use an app or you receive in-person therapy. The outcomes are basically the same.
Wow, I didn't realize that. Let's just really quickly describe how hypnosis works.
So a bell goes off and you cluck like a chicken.
Right. Perfect. A lot of chickens clucking in my office.
That's the stigma, right?
Right.
You will sit in a comfortable environment, and prior to the pandemic, it tended to be in your office with your clinician. Now, and again, research supports this. You can do it from home, so you can do this virtually with a therapist. And the stages are you become comfortable, you close your eyes, we walk you through what's called a passive muscle relaxation, which just feels really nice. If you've ever done a yoga class and think about Shavasana, that's kind of the goal here is relaxing all of the muscles. There's then kind of we call it deepening, where we'll take you usually by counting down and starting to also use imagery. So thinking about your body floating very comfortably and securely on a cloud. Once we get you down, really what this means is we're taking your focus and really intensely having you follow my voice, follow the things that I'm describing that are visual, auditory, really appealing to the different senses so that you're experiencing it and you're letting your imagination fly. And then we use very peaceful imagery to explain a scene and also start to give suggestions about the calming, the soothing, the functioning of your gastrointestinal tract. And then we count you back up. So the whole process takes about 30 minutes. And I'm sure you anecdotally, I have had on less than one hand patients that do not like the intervention.
Right.
People find this to be, once they get through the first session, which naturally, and I think it's very reasonable, they're curious, what's it going to be like? Am I going to be hypnotizable? A lot of people will comment on, oh, that feels really similar to when I do meditation or guided imagery or using my Calm app. It's just I've never had the opportunity to hear suggestions about my gut and my brain-gut connection in that way. I like that. So
if they even remember.
If they remember.
Sometimes people come out and they're like, what? I didn't hear anything after cloud.
Yep.
But one point you make in the book that I think is important if people do try this at home is the depth of sort of unconsciousness that you get to does not predict outcome. So you don't have to go really deep to actually have an effective response, right?
That's right. That's right. Hypnotizability, which is actually something we can assess for, but I really don't care in my clinical practice. We've got patients that will say, like, I don't remember a thing, or they'll say, they can recite almost the whole thing.
Right.
And so validating that whatever your patient experiences is just what it needs to be.
Yeah. It's a really cool experience to do as a therapist. For all of the mental health professionals listening, we do have a lot in our audience.
Yeah.
It is one of the coolest things I've ever done as a therapist. And just to witness the changes right in front of your eyes is pretty cool. Okay. We could spend the whole time on hypnosis, but we're going to move on. I think even though your co-author, dietitian Kate Scarlata, could not join us today, I do want to touch on diet because this is complicated. You mentioned earlier, diet can be a huge point of intervention and not for everyone. Mm-hmm. And there are very important psychological considerations when even introducing the idea of elimination of foods or restriction, right? So what typically comes first in a dietary intervention? And then what do you as a clinician kind of watch for or keep your eye on when someone is actually restricting foods?
Yeah. In the book, we talk about something called a gentle diet cleanup. So before we dive into something like the low FODMAP diet, we're going to have people just take a step back and look at, what's your coffee consumption? If you are somebody with horrible diarrhea and you're drinking 6 cups of coffee and coffee is a natural laxative, then we might just be able to pull that back.
Right. Easy answer, possibly.
Yep. If you've got little kids and, they're consuming a ton of apple juice or sugary beverages, or you as an adult are a sugary beverage consumer, pulling that back a little bit and seeing how your body responds. I always feel so lucky when it's like, oh, that little change makes a profound impact on things. That happens sometimes, and you just didn't have that information to make that change. Looking at alcohol consumption, looking at, how much processed food or fried food, high fat foods that you might be consuming. Looking at some people who kind of start to restrict that. So moving into that second part of the question, looking at people that say, oh, I don't eat breakfast. I eat my lunch after, at the end of my day. And then I have dinner at 8 o'clock or 9 o'clock with a 10 o'clock bedtime. We're looking at that and starting to kind of say, well, all right, let's look at your metabolism and look at what your body naturally wants, as it likes consistency. It likes when you kind of start the day with some protein and we have breakfast, and then, thinking about it like you're fueling the car. And so by the time, your hunger cues jump in and we start to think about lunch, then that's a great time to fuel, and then maybe a snack and then dinner. So most adults can really tolerate and do really well with about 3 meals a day and 1 to 2 snacks. So if somebody's coming in and they're more on that spectrum of like, I don't eat all day, I eat my large meal at night because I know that I've gotten everything done and I'm not hungry. And, I eat a McDonald's cheeseburger, a Coke, and I can tolerate fries. I can't tolerate anything else, but I can tolerate those things. Then I'm seeing too much food restriction. I'm seeing a considerable reduction in the variety of foods that you're introducing to your body. Your body wants a lot of variety. And so when you take that variety out, each time you reintroduce something, it's normal to have some bit of a response. So if we're restricting too much, if we've lost a lot of variety in our foods, that's when I'm starting to consider, all right, let's look at the psychological side of this, the anxiety of food, which is very common in people that are living with GI conditions. And then I'm engaging the team. And depending on the severity of food restriction, food fear, food anxiety, we might need to engage with an eating disorder specialist, and also really providing that patient with a lot of support around, we get it. If food hurts and causes you symptoms, it makes sense why you want to avoid it.
Right.
But we can work together to really get things back on track with a good team. So one other thing that I'll just say is that, if a patient has a history of eating disorder, let's stay away from the nutrition therapy, and let's shift into some of our psychological therapies to address their GI condition. And that, I think, is a really important point for providers to be mindful of, that it is important to ask your GI patients, do they have a history of eating disorder, so that informs the different strategies that you might recommend to your patients.
Right. So diet and restriction may not be a healthy avenue for everyone. And it's important to recognize that and realize there's still options. There's still other avenues for improvement. In fact, you have a whole chapter. I love the title of this chapter, Making Sane Choices in a Food Fear and Weight-Obsessed Culture. So you give a lot of guidance on navigating food restriction and nutrition. And one part I really wanted to point out is the role of social media. And as you state, anyone can call themselves a gut health coach or a holistic nutritionist. And we've talked before on this podcast about the dangers of pseudoscience. So could you speak to what can be risky about gut pseudoscience?
We call it snake oil. And unfortunately, I'm sure you see this in practice too. When you are living with a GI condition that has such a profound impact on your quality of life, you are desperate to feel better. And so if you Google IBS remedies or cure my IBS, you are going to find people that are making false promises. You cannot cure IBS. So if you find something on the internet that says they'll cure your IBS with their supplement plan or their detox, red flag. Our goal with treatment is that we can improve the severity of your symptoms, the frequency of your symptoms, how long you experience your symptoms. We will empower you so that when and if you inevitably have a stomach ache or a bout of diarrhea, you've got a whole toolkit that can get you under control much quicker. But the pseudoscience out there, I think, preys, unfortunately, on people that are suffering. And so people can curate their own supplement plans that cost thousands of dollars. God forbid, coffee colonics or doing, any colonic. If you have never had a colonoscopy, then you talk to your doctor about getting a colonoscopy. But colonics are essentially colonoscopies that could perforate your bowels and cause severe damage. And so, again, that's one of those pseudoscience things where you can go to a fabulous med spa and they'll offer this to kind of help with your gut health or optimize your gut health. And it's really dangerous, and there's no science that supports it.
Yes. And one thing I'll point out is you actually have a list in the book of supplements with a scientific backing. So I think it's a great resource to help tease apart because there's so many products out there. Supplements are not regulated by the FDA. And so anything can be sold, basically. So we have to be very careful. Okay. We're almost out of time, but I have to at least bring up the gut microbiome because it has become very trendy in pop culture to talk about the gut microbiome, which relates to the pseudoscience. So what do you have to say about it? Like, what is your last word from the expert, the scientist, about the gut microbiome?
Well, I think the first thing is that it's so cool that the gut microbiome is getting, its due limelight, and it will continue because where the science is at in terms of the microbiome is it's in its infancy. And where I think it'll go in the future is more precision medicine, where we can, get a snapshot of what's going on in your microbiome and tailor certain medications, therapies based on, your individual fingerprint that is your microbiome. We are nowhere near that right now. And so that's what, to the point of, supplementation and these protocols that you can find, our science doesn't allow for that just yet. And so wide sweeping panels of blood work and stool that you can send off to different holistic centers, we can't learn a whole lot about that right now. What we can do about our microbiome is we know that essentially eating the rainbow. So the more variety you can introduce to your microbiome through food naturally, not through supplements. And I'm not here to knock all supplements, but I think that the more natural remedies that you can do through your garden or your grocery store or the frozen food section, frozen fruits and veggies are great as well. That's what you can do today to help your microbiome. Kombucha, things that are fermented. There's a little bit of interesting research we talk about in the book from that perspective that can really kind of get the microbiome happy. But my long-winded final words are that we don't know a lot. We're learning. And the things that you can do are, trying to eat a variety of foods. And if you've restricted too much, that's when I want you to reach out to a registered dietitian who specializes in the gastrointestinal tract, and they can help you.
Get good guidance.
Get good guidance, yes.
All right, Megan, we could go on, and there's still much to cover, but this is what we have for today. And I want listeners to know that your book is chock full of useful resources like gut-friendly recipes, shopping lists, scientifically supported supplement lists, and even a colonoscopy coping prep kit, which those of us of a certain age need to get our colonoscopies. So
That's right. That's right.
that in itself is very helpful. So congratulations on getting this incredible gut guide into the world. Where can people find more about you and your work?
Well, you can find us on Instagram. So at Mind Your Gut Official on Instagram. The podcast, the Gut Health Podcast, is also on Instagram. You can find our podcast anywhere on podcasting platforms. I've got drriehl.com and then also katescarlata.com. So there's lots on social media that you can follow along with us. And we're having a lot of fun with a lot of variety of GI gut health topics on the podcast. So we would love for you to check us out there and learn more.
Great. We will put links in our show notes to all of those things. Thank you so much for your time today, Megan.
Thank you so much for having me and for all the work that you're doing.
Thank you for listening to Psychologists Off the Clock. If you enjoy our podcast, you can help us out by leaving a review or contributing on Patreon.
You can get more psychology tips by subscribing to our newsletter and connecting with us on social media.
We'd like to thank our podcast production manager, Jadine Stout-Williams.
This podcast is for informational and entertainment purposes only and is not meant to be a substitute for mental health treatment. If you're looking for mental health treatment, please visit the resources page of our website, offtheclockpsych.com.